Thank you guys all for joining us this afternoon. It's good to be back on Facebook Live. We wanted to do kind of change things up just a little bit in our Facebook Live formats. As you know, we tried to do these quite often, Dr. Pruitt and I, during COVID, to give updates for folks about what was happening and current trends and whatever the latest guidance was. And so what we found is we're going to try to do like a short and condensed versions a little bit better. So this one's probably going to be like 15 to 20 minutes. So thanks to everybody who's jumping on, and good afternoon to everybody, and just kind of hit some of the biggest facts. Today, we're just going to talk about RSV, flu, and COVID as respiratory illnesses are on the incline, and rightfully so in the seasonality of Michigan. As we know, things are getting colder. Snow's not falling yet today, but probably will be soon. And with that comes cold, flu, and just, that nasty season. So I'll do what I normally do in terms of talking about those three topics and what the data is currently telling us. And then Dr. Pruitt will lend some of the signs and symptoms, differences, what we can be doing, as we go into this season. So first, let me just say, to get things started, that, we are looking through a new lens, I think, in which we talk about the spread of diseases and particularly respiratory illnesses. I think the media, the public health, folks are looking at the spread of disease in a different way, in a new way, some of which is good. But it's also important to remember to keep things into perspective. And so, as you know, we like to always put things into perspective, talk about what we know and what we don't know, and not leave things to, just fear and speculation, but kind of focus on those pieces first. So let's, when we say that, I want you guys to know that it is expected to move into an increase in respiratory illnesses. This isn't anything new, right? Dr. Pruitt, you see flu patients every year in the winter months, right? We know. Yep, RSV season as well. So we know that likely, we all get our flu shots those of us that do get flu shots, get them in the fall, to take us through. And so traditional flu season in Michigan is right around December, which is what we're coming into, all the way till probably the end of March. So I think technically they say till April, probably just depends on the weather of, the groundhog and whether he sees his shadow. But that is typical of what we see. So data is also kind of moved. And so when we talk about RSV data, we talk about influenza data, and we talk about COVID data, it's important to know that it's kind of a pulse on the activity of what we've seen, right? So we don't do testing like we did during COVID, and that's the important difference. So as you guys all know, we did extensive amounts of surveillance testing because early on we needed to know how great was the spread, what was happening. We were trying to learn from the virus, all of those things. And now we know we've moved away from as much PCR testing, for example, for COVID, and we've gone into home antigen kits, right? You can order your home kits. You can test yourself at home with a rapid test. And if you're sick, stay home for 5 days, right? So flu is similar to that. There is no, aggressive testing strategies when it comes to RSV, when it comes to flu, and now when it comes to COVID. We're beyond that, right? So it's a pulse of what's happening. So as people have said, well, now that everyone has a home test kit, COVID must be much worse than it is. And that's part of just knowing what the pulse is, because it's like, we know it's here and it's going to continue to be here, right? And there'll always be some level of testing that's happening. So just keep that in mind as we talk about the data and we talk about what it looks like in terms of spread. So when we talk about COVID, I'll start with COVID first, and then we'll talk about a little bit flu and then RSV. But for COVID, spread remains pretty stable. But as you know, last December, incredible spike, right? Omicron had hit. And so we saw the largest spread of COVID that we had seen. We're not anywhere near to those kinds of numbers. So the good about COVID is it has stabilized a little bit. And I think it's starting to even out to where we think about baseline levels of data of COVID, right? Always going to have some level of spread. But as we've been tracking our COVID numbers and have continued to do that just on the PCR testing side, we've been averaging 30 positives a day for months since probably since August or September, when we started to see it just increase a little bit, and it's been relatively stable. And if you go to, you can still go to the My Start map, you can look at where we're at, you can still put the county level community indicators in there, and most of Michigan is low. There's probably 7 or 8 counties that are medium. Saginaw is one of them. And so we've seen relatively, though, even in the rest of the country, as you know, it used to be in the summer, the South was red, and then in the winter, the North was red. And so the North hasn't even been red as we look at some of the counties around us. And so it's been slower, right? Which is what we want to continue to see, as that kind of slow, even a spread as we continue to move through. So in terms of flu, let's look at, and if you aren't aware of this, My Flu Focus is a great one in the state of Michigan. MDHHS puts out, and let me share the screen for this. Hold on just one second. It's called the My Flu Focus, and they put it out every week, and it starts usually with the beginning of flu season. I think maybe in November they start it, and we start to look at across the United States. There is an influenza-like surveillance network nationally, and we start to look at this one, make sure I'm sharing the right one. I hope you guys can see that. So it's issued every week, and it gives a little colored map of what the influenza-like activity. Now remember, this is influenza-like activity. So again, we're talking about the pulse of the community. So what happens is there's some level of testing happening at the provider level. And we gauge a pulse of where we're at. And as you can see from this map, actually Michigan, if you can see it, hopefully it's big enough, is green, which means we're in sort of minimal and no real flu activity. Now, I will say some of the states around us that are red, most of them are red, you can see that they were green a couple weeks ago. And so we know that it's coming, right? Just as we've said previously, flu has been relatively low, but we can expect that we're going to see that start to increase, right? So, we'll talk about, so what does that mean? What should we be doing in a few minutes? One part I wanted to point out when we look at flu is obviously hospitalization. So as you know, a lot of this focus is always on hospital capacity, which we know our hospitals continue to be stressed with not adequate resources to be able to take care of, and have as many beds and patients availability as before. And so when we start to hear about all the things coming at us, flu we know is one of them. And it's a little early right now to say like where we're going to be, but in these projections, if you can see from this graph here, these are overlapping years. So each color is a different year. And it again ranges the flu season. They're by the actual weeks of the year, right? So on here, week 52 is, the end of December. So this is where we're at currently. So the black dotted line is our current 2022 to 2023 season. And so we're seeing this increase right now, which is why everyone's like, whoa, what's happening? This could be the worst flu season we've seen. Well, as we know, the last couple of years, we've seen incredibly low levels of flu that have been spread, and rightfully so, because in 2020, when things were closed and we were staying home and we were throwing everything at COVID, including the kitchen sink, we also saw all the respiratory illnesses weren't circulating as well, right? We stayed home, we stayed away from each other, we were washing our hands, we were wearing masks, we were following the 3 Ws, we were doing all of those things and then some. And then, of course, we've seen a little bit higher numbers. So in the last couple of years, we haven't seen it. So I think that's one of the concerns for alarm is to say, okay, we may be having a bad flu season. But if you'll notice on here, the 2017, 2018 flu year was a very bad flu year. And we have seen levels like this. If we go back even 10 years before, you would have seen some really high spikes in the cases and hospitalizations due to influenza. So what we're trying to avoid is, the blue type line that we saw from 5 or 6 years ago. But every year it does change a little bit. Every year we peak at a little bit of different times, but the next sort of 3 months is where we're going to continue to watch flu and see what happens. So then let's just switch, and I don't know if I can let me just stop my screen share because sometimes this doesn't work. RSV, right? So that's what we're also hearing a lot about in the news is the concern around RSV. And RSV, again, is a pulse. There is no state dashboard for this one, so we have to go to the CDC. They do have a RSV state trends. And again, this is similar to influenza. So it's some providers that send samples. There's antigen testing. There is PCR testing as well. You can click on the state of Michigan and it will give us some graphs initially here. And so as we look at these things, there's kind of two overlapping pieces that we see with the RSV testing. One is antigen tests. So as we know, those are kind of like the rapid swabs that test really quick, an over-the-counter type test, if you will. And then we have PCR testing, where again, you go to a lab, it's sampled and tested on laboratory pieces of equipment that gives you more of that definitive test. And so these are the two pieces that we're watching in terms of RSV. I think a couple of things that are different to know this season is that antigen testing, because we're starting to see an increase, right, in folks that are being hospitalized for RSV, we're seeing a little bit less antigen testing happening, a higher percentage of PCR testing currently happening. And what it's telling us so far this year is that our tests are up a little bit in comparison to last year, which again, as we go into this season, if you go look at these graphs, you can see the seasonality is like the highest peaks, in the middle of the graph are last year at this time versus the very far right axis, which is basically like today. And you can see that last year we did a lot of PCR testing actually right around the December timeframe, but the positivity was relatively low. So we're testing more people. So the denominator was big. And so the positivity rate was lower. So we're not yet having the same kind of PCR testing happening, but what we're seeing is a high level of positivity, right? So that is suggesting that we've got more community spread going on because more of those test samples are coming back positive, right? So those are the things that we want to watch out for. We're also including a lot more adults in the RSV as we previously have over the years, and a lot more concerted testing is happening now because that's just what we do in surveillance. Part of as we see diseases emerge is always conducting a certain amount of surveillance to sort of ascertain what does that spread kind of look like. So all of these things are kind of coupling together, but knowing that it's giving us just what are these pulses look like. And so what we want to do is keep folks and children, particularly with RSV, out of the hospital, right? We're not seeing as many COVID hospitalizations. We don't want to, we typically are seeing a little bit higher for influenza right now. And then of course, what we've been seeing is more relative to RSV, right? And children with RSV. So we want to make sure that we continue to maintain what the capacity can be locally for us. And so it kind of points to, Dr. Pruitt, what are the things that we should be looking for? How do people know the differences? And most importantly is, what do we do about it? What's the so what of what we can do to help reduce our own risk? So yes. I will turn it over to you and talk to us about, what's the difference?
Yeah, so first of all, let's just say they all are kind of the same. They all are viruses. And so when you look at COVID, RSV, and flu, they have very similar cough, they have fever, and they have sneezing, sore throat. So all of this is kind of common. But there are some subtle differences. And one of them is that, I don't know if you guys have noticed, but if you've ever had the flu, which I've been fortunate, or I don't know if the word is, could be unfortunate, I'm not sure, to have had COVID and the flu, that the flu comes on pretty suddenly. So you could be doing pretty good, and all of a sudden you get this fever that hits pretty high, and then you feel very sick. Flu can come on very suddenly. COVID kind of comes on like you feel like you got allergies or something comes on, and it get progressively worse, and it can be very gradual. RSV is kind of gradual too. So that might give you some indication that all of a sudden you feel sick, you got this fever, you're okay, and then you have a fever. Could be the flu. Also that diarrhea is something that's pretty rare with RSV. So that's something that you can look into. If you start having diarrhea, it could sometimes happen in COVID and sometime in influenza. If you have loss of taste and smell, that is something that's pretty, what we call pathognomonic, which means it goes specifically with one condition. And that one usually goes with COVID, and it's pretty rare with RSV and influenza. So that's something that you can say, I probably have COVID. Now, if you have muscle aches or body aches, flu and COVID usually have some of that. It's sometimes with COVID, some of the people who had the body aches with COVID complained about body aches significantly. So the people who had them said that they were terrible. And I don't know, for those of you guys who've had the flu, I had that 14-day flu, you know, the one that puts you in the bed and you don't want to get out because the body aches were so bad. So if you've had that flu, you know that the body aches come with that. You know, shortness of breath definitely can come with COVID, and people who've had COVID knows that, especially if it gets difficult. And definitely with RSV, people can have shortness of breath. Here on this sheet, it says that shortness of breath is rare for the flu, but definitely if flu becomes complicated, you can have shortness of breath. Definitely you get pneumonia with the flu. So that can be something that's complicated, a complication of the flu. With RSV, you have rarely vomiting, and then wheezing is rare. Sometimes with RSV, they say rare with COVID-19 and influenza, but it just depends because, you know, it depends on if you have asthma, allergies, things. It can rear up some wheezing, so wheezing can be complicated with all those things. So what am I trying to tell you? It's hard to decipher which one you have. I know loss in taste and smell could be one of the things that can make you think you have COVID. If you have some symptoms, I have allergy, cough, sneezing, whatever. If you have some COVID-19 test at home, go ahead and test yourself. You have that available. If you don't have COVID-19 test at home, guess what? We have some here at the health department. When you walk in the door, we have them here. You can sign them out. You can get some tests and test yourself just to see if I have COVID-19. If you're 12 years and older, you can be treated if you have certain conditions. And your healthcare provider can help you determine if you have those conditions to be treated for COVID-19. Also, flu is one of the conditions that can be treated. And so flu can be treated. And so your healthcare provider can help you with treatment. So for 2 of these conditions, you can be treated for and tested for. Not everybody needs to be tested. This is the key. And so you don't need to be tested for RSV. RSV is a very common cold. Most adults with healthy immune systems have RSV and they say, I just have a cold. RSV has been here. Guys, when my twins were born, they were in the NICU for 5 days. I was so disheartened because nobody could see my beautiful twins that were born in the NICU because they would not let anybody up there because they didn't want anybody to bring 10 years ago RSV up into the NICU. They had to wait until those babies were discharged from the NICU to come out so that RSV wouldn't be in the NICU. We knew about RSV then, okay? So RSV has been around all this time. Like Chris said, it was our mitigation strategies. We wore masks, we stayed away from people, we washed our hands, and this is the reason why people haven't been exposed to RSV. People are getting sick, but it's always been here. This is nothing new. So RSV has been around, and so the very young people young people and the very old are most at risk for RSV and having complications from RSV. And also people with weakened immune systems can have RSV. So you say, what do I do then? How do I help myself with all these viruses? What can I do to make myself healthier or, prevent myself from getting the virus? Well, we do what our grandmother told us to do, right? What she taught us to do. We do what we know that we should be doing all along, right? We wash our hands when we come in, right? We've been saying this all this time, right, Chris? We wash our hands.
Absolutely.
We clean our surfaces, right? And then we get vaccinated for the things we know we can be vaccinated for, right? So we know we can get a flu vaccine. And this is Flu Awareness Week. And so we get our flu vaccine because we know that that's one of our prevention measures to make sure that we don't get sick. We get our vaccine, we get our COVID vaccine, because that's one way we know we prevent ourselves from getting sick. And we don't want to be like dealing with long COVID syndrome, like long hauler syndrome, and then we get RSV on top of that. Well, now we fight one thing and then we have to fight another. And our immune system was weak and then we have to fight another disease. We do all we can to protect ourselves. So we get our vaccinations, we wash our hands, and then like Chris said, we stay home when we don't feel well. We just stay home. Now, sometimes we can't stay home because we have stuff we got to do. And if we don't feel well, then we put on a mask. Now, if we have COVID, we know the rules with COVID. You stay home for our isolation time period. And then after those 5 days, you put on your mask, as long as you don't have a fever and all of that. And then you put on your mask after that. But we stay home when we don't feel well. We keep our children home when they don't feel well, right? And then we send them back with their mask on. If you have a cough and you have a cold, put the mask on so you don't want to spread it to anybody else. It doesn't have to be COVID. There are a ton of other viruses out there besides COVID, RSV, and the flu. There are other viruses that you can spread to people. Right. There are other ones. So what do you do for your fellow person that you don't want to spread it to? You could wear a mask so that you don't spread it to other people if you have to go out, if you know if you're coughing and sneezing, because this is how these things spread. Coughing, sneezing, touching people, when you go like this or this, when you're coughing and sneezing and you spread it. So keep your hands clean, keep your area clean. And if you're sick, stay home and know that you can be treated for some of these illnesses if you get them.
I think that's just a honed in message, which is our tried and true public health message around stopping the spread of disease. And, if COVID taught us anything, hopefully it was that when we are sick, we don't like to get other people sick. I think most people say like, oh, but before it was just a commonality that I go about my day if I can just, tough it out. And hopefully we think a little bit more about, what, I'm not going to, go see my grandma because I don't feel good today, or I'm not going to go to work, or I'm not going to send my kid to school when the school's going to turn around and call me in a couple hours anyway to pick them up. So, it's not an easy thing. We know that, but making a conscious effort to do the things that we can to reduce that level of transmission, to keep ourselves safe and our family safe and healthy throughout the holiday season. So anything else, Dr. Pruitt?
No, we're going to be making some videos for you to talk about more issues because I know you have more questions to put out there. But I think this is a good start to say, stay healthy, stay happy during this holiday season, spread love and cheer and not viruses. Do what we have explained, and which is keep your hands clean, keep yourself at home when you're not feeling well. We wish you the healthiest and happiest holiday season.
Thanks, everybody. And until next time, we'll see you then.
Bye-bye.
Bye.